To mask or not to mask? That's no longer a question in several parts of South Korea, including Seoul, which began to mandate face masks as of this week in its latest efforts to control the most serious COVID-19 spike in this country since last March. With the capital region being particularly hard hit for the first time, everyone in Seoul must wear masks when indoors, except when eating or drinking, and outside, unless there's no one around you. What's important, according to the city's Director of Public Health, Park Yoo-mi, is wearing a mask in itself. Until now, such orders have only affected the general population in Seoul when traveling by public transport. But voluntarily wearing masks has been credited as one of the reasons for South Korea's success in containing COVID-19 over the last few months, alongside testing and tracing. The problem now is that clusters have been increasingly popping up without clear traceability, placing even more focus on the mask strategy. Eun-kyeong, director of the Korea Centers for Disease Control and Prevention, has stressed the dual purpose of wearing a mask to prevent others from infecting you and to prevent you from infecting others. This was clearly highlighted by the recent cluster at a Starbucks in Paju, north of Seoul, where an air conditioning unit is believed to have helped cause 27 direct infections, more than 60 when including indirect cases. But the staff, who were wearing KF94 masks, the Korean equivalent of N95, were fine. As stated by Kim Woo-ju, a professor of infectious diseases at Korea University in Seoul, the ratio of bacteria and viruses that may enter the mouth without versus with a mask is 10,000 to between just 1 and 3. And one of Korea's strengths has been widely accepting the abundant evidence that appropriate masks, properly worn, are protective. It's now up to the people to step up again to avoid unnecessary infections, stricter distancing rules, and more economic pain.